Hi, my name is Olivia Quimby. I'm a student nurse at the University of South Alabama, and today I'll be doing the medication administration checkoff. So now you will scan the room. Okay, so the first thing I'm going to do is I'm going to check to make sure I'm in a no interruption zone. This means I'm in a room, the medication room with the doors closed. I do not have my phone around me or it's not distracting me, and I have little to no communication with my colleagues, meaning I won't be distracted unless if it's an emergency. This is to totally focus on the procedure that I am doing now. So now I'm going to compare my MAR with my patient care order form. I'm checking for the 5 rights: right patient, right medication, right dose, right route, and right time. So I have Mr. Jaguar Jones. Today we're administering heparin, 5,000 units, subcutaneously, every 12 hours and every 12 hours. I also see that Mr. Jones has an allergy to penicillin and an allergy to penicillin. Okay, so now I'm going to just use my MAR, I'm going to perform hand hygiene, and then now I'm going to select the correct medication. So I am selecting heparin. So I see heparin and heparin. The expiration date on heparin is 12/5/2025, and it is still in date. Perfect. Okay, so I also see for heparin that it is administered subcutaneously. So I will need to get my 1 millimeter TB syringe, and I will use that. And then I see it's administered every 12 hours, and I know on the MAR that Mr. Jones has not received his medication in the past 12 hours. So I also note that heparin, it is asked to be given in 5,000 units, and on the vial, it has heparin 10,000 units per 1 milliliter. So I know I will have to do some calculations. So in this, with 10,000 units per 1 milliliter and needing to administer 5,000 units, I will give Mr. Jones 0.5 milliliters of heparin. So now that I've correctly calculated, I'm going to clean my vial and get ready for drawing out the medicine. Perfect. I'll get my syringe out, and I'm going to draw out 0.5 milliliters of air. Okay. Now I will uncap, and I'm going to puncture the vial. And then I'm going to inject the air. And I'm going to flip it up, and I'm going to pull out 0.5 milliliters of heparin. I'm going to do a little bit more just so I can get it accurate and push out any air bubbles that might be in the syringe. So perfect. Now I can take it out. Going to use the scoop method. Now I'm going to compare my syringe with my MAR. So heparin, make sure this is heparin again. Heparin, 5,000 units or 0.5 milliliters, and I have 0.5 milliliters of heparin in here. So now we'll check it with you. And then normally I would ask another nurse to just go over my calculations and make sure my dose is correct as well. So now I will do the second accuracy check. And so in this, I'm going to use my vial, my syringe, and my MAR. So I have my patient as Mr. Jaguar Jones, and we are administering heparin and heparin. We're doing 5,000 units or 0.5 milliliters, and I have 0.5 milliliters. And we are doing it subcutaneously, and this is my TB syringe, so it is subcutaneously. We're doing it every 12 hours, and I know indicated on the MAR he has not received it in the past 12 hours. So now I'm going to create a label to put on the syringe. I'm going to put 4 things on the label. Going to put Mr. Jaguar Jones, the name of the patient, the medication that is in the syringe, so heparin, the dose that's in the syringe, so 5,000 units or 0.5 milliliters. And then I'm going to initial, so I know these are my calculations. Now I'm going to put it on the syringe. And now I will take my syringe and my MAR and go to the patient's room. So now, first I will do hand hygiene, and then I'm going to identify the patient by using two identifiers. So I have his armbands right here, and then I have the MAR. So I have Mr. Jaguar Jones, Mr. Jaguar Jones. His date of birth is August 25th, 1963. August 25th, 1963. I see that Mr. Jones has an allergy to penicillin and an allergy to penicillin. Now I would ask Mr. Jones if he has any other allergies or if he knows his reaction to his allergies. I would also do any other pre-administration assessments to this particular medicine, heparin, before administering the medication. So now I'm going to do the third and final check for accuracy. So I have my syringe, my label, my patient's armband, and my MAR. So I have I will go through the 5 rights in this one as well. So I have Mr. Jaguar Jones, Mr. Jaguar Jones. Today we're administering heparin. I see heparin. I have my 5,000 units or 0.5 milliliters. So I have 0.5 milliliters or 5,000 units. We're administering it subcutaneously, which is I'm using my TB syringe. Then we're doing it every 12 hours. And as indicated on the MAR, we have not done this in the past 12 hours. So now I'm going to explain the procedure to my patient. So I will just let him know how I'm going to be administering this medication, and I will let him know before I inject the medication. So now I'm going to raise the bed to working height and then lower the side rails. And then I will put on my goggles and then my gloves. Okay. So now since I have my gloves on, I'm going to check for where we are injecting the patient with his medication today. So Mr. Jones, we are going to do an abdominal subcutaneous injection site. So for this, I will avoid a 2-inch perimeter around the umbilicus. I'm also not going to go above the intercostal margin or below the pubic area. And then I'm going to stay in between the anterior superior iliac spines on the lateral portions of the abdomen. So this will create a U or an N shape to inject it. I will also assess his abdomen to see if there are any bruising or any skin integrity that I should note before administering the medication. So now, since I've assessed the patient, I've done all 3 checks, and now I'm going to clean the injection site. So I'm going to use an alcohol wipe, going to clean in circular motion. And I'm going to leave the alcohol wipe pointing towards where I've cleaned. So now I'm going to take my syringe, I'm going to remove the cap. Today since I can pinch up 2 inches, I'm going to inject at a 90-degree angle. So I'm going to pinch up, inject, then administer the medication slowly. I'm going to take out the medication, dispose, and now I'll apply gentle pressure to the injection site, being sure not to massage. So I'll dispose of this as well. So now I'm going to reposition the patient so that he is comfortable. I'm going to lower the bed to the lowest setting, raise the handrails, and I will remove my gloves. And remove my goggles. So now I'm going to perform hand hygiene. And then I'm going to assess and observe the injection site, making sure that there are no allergic reactions that have occurred since I've administered the medicine. And now I will document on the MAR, the 6th right, I will document how the patient tolerated the procedure and if there were any allergic reactions. Then later I will return to the room to the patient and assess to see if there was any allergic reactions that appeared later on. And that is the end of this checkoff. Thank you.